When we talk about coping, obviously COVID-19 has caused a lot of fear, uncertainty, loss. Many people have lost their loved ones, they've lost their jobs, which means they lost their income. And I think one of the biggest losses is just an overall sense of normalcy. So obviously these things create stress. And, when people are stressed, the natural response is to seek ways to comfort, distract, or soothe yourself. And people use many things to do that, as we know. Food, alcohol, entertainment. These are just some of the things that people use to try to help themselves get through hard times. And in the world of psychiatry, when people seek to comfort, soothe, and distract themselves, that's called coping. Um, Another way to think about coping is to ask the question, what do I do when I'm stressed? Or what do I do when I've lost a sense of control? So, generally speaking, there are two types of coping. You have your positive or adaptive coping, and then you have your negative or maladaptive coping. So, with negative or maladaptive coping, people generally engage in activities that will, get them through the stress in the short term, but often it causes a lot of stress in the long term. Some examples of that would be misuse of prescription medications, excessive use of alcohol. Some people overeat. Some people may sleep excessively or overspend. I'm sure Amazon could testify to the fact that their business has definitely increased during COVID-19. And I actually have a friend who works as a delivery driver, and he was saying that, how much his business had picked up since the pandemic. And he was saying that it picked up even more so after people got their stimulus checks. So in that case, that could probably border on maybe overspending because, you can see why in the moment, it could be exciting to get something new and shiny delivered to your doorstep, but maybe down the line, a person would regret maybe not having saved that money for things like groceries. So, that's kind of your maladaptive coping. So, with your positive or adaptive coping, those include activities that really allow a person to stay in the present moment and to really work to actively solve their problems. So examples of that is exercise, meditation, um, reaching out to a friend and asking them for help. Because let's be honest, it's difficult for all of us. Just me personally, I am quarantining alone. Well, it's just me and my cat, but I've had a lot of days where it's been lonely, it's been difficult, depressing. So do not feel any shame in reaching out to a trusted loved one or relative who will be supportive to you to ask for that help. So, I certainly recommend that. And in general, as a rule of thumb, anytime you are inviting people into your struggle, that's generally going to fall under the category of, positive coping. So in summary, you want to really be mindful of the things that you're doing during this time to cope, because you don't want to come out of the pandemic worse off than you were before you went in. So for people who may not be connected to a mental health provider, say for instance, you don't have a friend that you can talk to, I strongly encourage folks to connect with a therapist, a counselor. Lewis has put up some great resources on the screen. If you are a Wayne State student, you have access to the CAPS program, which stands for Counseling and Psychological Services. You just log on to caps.wayne.edu, or you can call 313-577-3398. Also, if you live in the state of Michigan, you also have access to free and confidential counseling. You just log on to michigan.gov/staywell, and they have basically a free number that you can call to access counseling 24 hours a day, 7 days a week. You got 1-888-535-6136. You press the number 8. And if you don't feel like talking, they've even set it up where you can text the keyword restore to 741-741. Also, you do have the option of talking to your primary care doctor for referrals to a mental health professional. So hopefully these resources can be of help to you.
All right. Thank you so much, Dr. Howell.